The Ministry of Health has inaugurated a new 10-member committee of the National Immunization Technical Advisory Group. Representative of the Minister of Health, Kwabena Mintah Akandoh, Madam Grace Ayensu Danquah, delivering a speech on behalf of the minister, says the advisory board is to ensure that Ghana immunization decisions align with global standards.
It marks a renewed national commitment to strengthening evidence-based immunization policy and ensuring that Ghana's vaccination systems remain resilient, equitable, and responsive to both current and emerging public health challenges. Since its establishment in 2018, NITAG Ghana has played an indispensable role in shaping national vaccine policy, reviewing scientific evidence, offering impartial recommendations, and guiding strategic decisions that have strengthened Ghana's immunization program. Your work has supported the introduction of new vaccines, improved cold chain and surveillance systems, and contributed meaningfully to our progress towards universal immunization coverage. However, we recognize that global health landscape is evolving rapidly. Emerging pathogens, rising vaccine hesitancy, inequities in coverage, advancements in immunization technology, and the demand for timely, adaptive policies, responses to all calls for a more coordinated and forward-looking advisory structure. This newly reconstituted NITAG, bringing together returning and newly appointed experts, positions Ghana to meet these challenges and to support government's broader vision of a stronger and more equitable health system. This is the core mandate of NITAG. 1, to provide impartial, high-quality, evidence-based recommendation for national vaccines and immunization policies. 2, is to critically assess disease burdens, surveillance data, vaccine characteristics, and programmatic feasibility. 3, is to ensure that Ghana's immunization decisions align with global best practices while responding to our unique national needs.
Meanwhile, Chairman of the group, Professor Philip Baba Adongo, on behalf of his co-members, expressed appreciation to be called upon and pledged to bring their expertise on board.
And again, on behalf of the members, I would like to promise that we will put in all our best to continue with what we've been doing for the previous years, and that we will make sure that we provide all the necessary competence that we have to support the immunization program of the country. So, in short, we want to accept this membership of the NITAG, and that we promise to do our best to support the continuity of the activities of the NITAG. Thank you.
Representative from the World Health Organization commended the ministry for its policies.
I would like to pay tribute to the distinguished members of the NITAG who have completed their tenure. They have served Ghana with distinction, providing sound, evidence-based recommendations to the Ministry of Health that guided the introduction of new vaccines and strengthened the immunization program. During the COVID-19 pandemic, the NITAG stood strong. In a time of fear, misinformation, and intense external pressure, the group remained guided by science, data, and the best interest of all people living in Ghana. Their recommendations on the country's COVID-19 vaccination contributed significantly to reducing incidence and severity, and ultimately to breaking transmission of the virus. Ghana, Africa, and the global health community owe you an immense debt of gratitude. To the newly reconstituted NITAG, you assume your mandate at a time when the health and immunization landscape is rapidly changing. new technologies in vaccine manufacturing and delivery are emerging, but so too are the challenges: dwindling financial support, impact of climate change, and increasing vulnerability due to displaced populations, particularly the influx from the Sahel region. Ghana is in accelerated transition from Gavi support and is expected to fully finance its immunization program by 2030. This reality demands that Ghana makes the best use of science, not only to prioritize the introduction of new vaccines and technologies, but also to optimize the current vaccine portfolio for maximum impact.